Welcome to the bonus block party, which is just a little tag on to the upper limb session, which is talking about some distal blocks. So I'm just going to run through the radial, median and ulnar nerve blocks in the distal arm. So starting with the radial, this is the kind of setup that you might want with the patient's arm bent and maybe resting on their tummy and coming in from the posterior side of the probe like that. This is a video showing the kind of thing that you'll see. So this is the humerus, and we're going to find the radial nerve dividing. So a branch over here and a branch over here. And then as we come back up the arm, they would come together. But then we'll settle in that kind of position, which would be a decent kind of position to block this radial nerve here. So that division that we saw is actually the nerve dividing, sending off the posterior cutaneous nerve of the forearm, which is this one, which divides, that division happens about level of the mid-humerus. So if you wanted to cover the skin on the back of the forearm, you would actually need to block this component as well. So block it higher up before it divided, or block them separately. But if you just want a radial nerve block, which would include, it hasn't yet divided into superficial and deep branches, so it would include both of those, that would be this nerve here. So we can just watch that video again. As we come down the arm, divides there, posterior cutaneous nerve of the forearm over there, and the main radial nerve here. And then finding a decent level to block it, where that's a nice little level where there's a fascial plane that we could get into with the needle, and surround that with local. So just labeling up that picture, so posterior that side, posterior on the right, anterior on the left. The radial nerve there, the posterior cutaneous nerve of the forearm there, like we said. That muscle is brachioradialis, that is brachialis, and that is triceps, and then humerus down there. So to block that radial nerve there, I'd come in, try and get into that little fascial plane. You could probably stay well away from the nerve itself if you got into that little plane where the nerve is running, and then try and open up that space and surround the nerve with some local like that. Avoiding obviously the posterior cutaneous nerve of the forearm with your needle approach. Just something to be aware of when you're doing radial nerve blocks is there are some arteries in the vicinity. So the radial nerve tends to travel with the profunda brachii artery around the back of the humerus. So this is just a little video showing there are some pulsatile vessels in that area to be careful of with your needle approach. Going on to the median nerve, so that kind of setup with the probe on the anterior aspect of the forearm is the kind of picture that you'll get. So the radius is down here, so this is the kind of radial side of the forearm. So up here will be the radial artery with a little radial nerve next to it down in the forearm. Then kind of in the middle, towards the middle of the forearm, the ulnar would be over here. So towards the middle of the forearm, you get this nice little median nerve in the middle there. So the median nerve there, radial nerve there, radial artery there. The muscles are the deep flexor digitorum and the superficial part of the flexor digitorum, flexor carpi radialis, at that point, brachioradialis and palmaris longus tendon. And again, I always bring the needle in from the right side, avoiding any of these important structures here, of course. And again, getting probably not having to get right up next to the nerve, you could probably get into that fascial plane where it's running and try and surround it with some local like that. So then this is a little video just showing the median nerve is quite anisotropic. If you remember from the lower limb session and talking about the popliteal nerve, shows this kind of property called anisotropy, where it's, because it's not running completely parallel with the skin in the forearm, it's running from deep to a bit more superficial. So the angle actually that the probe needs to be at to catch that nerve at right angles isn't necessarily a right angle to the skin. So if you this just demonstrates a bit of tilting of the probe can make the nerve seem to just completely vanish. And then if you tilt and get the right angle, it's suddenly a lot more obvious. Okay, and then moving on to the ulnar nerve, that some set up like that. So similar to the median nerve, but obviously just further over to the ulnar side of the forearm. And this is the kind of picture that you'd get. This is a video just showing, oh, I'm just going to start that again. So starting with the picture that we just had for the median nerve, so the radial artery and nerve over here, the median nerve in the forearm here. What you can easily do to find the ulnar nerve is just slide over to the ulnar side of the forearm, which we're doing here. And then you'll most likely find another vessel, which will be the ulnar artery, and a nerve next to it, which will be the ulnar nerve. So this is just kind of scanning up and down the arm a little bit, just to find where they separate, so where the nerve separates from the artery a little bit, to make it a bit safer, find a decent place to block, which would be something like that. So that's a picture of that, just showing the ulnar nerve, the ulnar artery, and the needle approach into that fascial plane again to surround the nerve with some local. And that is the distal arm blocks covered. So thanks for watching. I hope you enjoyed it.